What is the role of sentinel lymph node biopsy in melanoma? Imagine trying to find out if a tiny seed has spread from a plant. In melanoma, that seed is cancer cells, and the first place they go is often the nearby lymph nodes. A sentinel lymph node biopsy is like checking the first stop on a journey to see if the cancer has started to spread beyond the skin. It is a surgical procedure that helps doctors find out if melanoma has moved into the lymphatic system. The sentinel lymph nodes are the first nodes that drain fluid from the melanoma site, making them the most likely places for cancer to spread early on. During the procedure, a doctor injects a special dye or a small amount of radioactive material near the melanoma. This helps identify the sentinel nodes, which are then carefully removed through surgery. The removed nodes are examined under a microscope to see if cancer cells are present. This process is usually done at the same time as removing the primary melanoma, which is called a wide local excision. Knowing whether the sentinel lymph nodes contain cancer helps determine the stage of melanoma. If the nodes are free of cancer, it suggests the melanoma has not spread beyond the skin, and the prognosis is generally better. If cancer cells are found in the nodes, it indicates the disease has advanced to stage 3, and additional treatments or surgeries may be needed. This information is crucial because it guides doctors in planning the best course of action for each patient. Not every melanoma patient needs a sentinel lymph node biopsy. Doctors usually recommend it if the melanoma is thicker than 1 millimeter or has other high-risk features like ulceration or rapid growth. For melanomas between about 0.8 and 1 millimeter thick, the decision depends on other factors, including the presence of ulceration or high mitotic rate. The goal is to balance the benefits of accurate staging with the risks of surgery. The procedure has been a game-changer in melanoma care for nearly 3 decades. It helps avoid unnecessary removal of multiple lymph nodes in patients who do not have spread, reducing potential complications. When the sentinel lymph node is positive, a more extensive surgery, called a completion lymph node dissection, may be performed to remove additional lymph nodes in the area. This helps improve local control of the disease and provides valuable information about prognosis. While generally safe, sentinel lymph node biopsy can cause some side effects. Patients might experience discomfort or pain at the incision site, temporary numbness, or swelling from fluid buildup. In rare cases, long-term swelling called lymphedema can occur, especially if the groin nodes are involved. However, serious complications are uncommon, and the procedure is considered a standard part of melanoma management. Understanding the role of sentinel lymph node biopsy highlights the importance of early detection. When melanoma is caught early before it reaches the lymph nodes, the need for this invasive procedure can often be avoided. That's why regular skin checks, sun protection, and prompt medical attention for suspicious moles are so vital. Early diagnosis not only improves the chances of successful treatment but also reduces the need for more extensive surgeries later on. For anyone diagnosed with melanoma, the sentinel lymph node biopsy provides essential information that shapes treatment decisions and helps predict outcomes. It exemplifies how modern medicine combines precise surgical techniques with careful assessment to improve survival and quality of life. Always remember, if you notice any new or changing moles or skin spots, consult a healthcare professional for personalized advice.